Hi, welcome to the seminar on 3 overlooked causes of the inability to lose weight. The holidays are over, and all the excessive eating and drinking is hopefully over. The stress of the holidays. So I myself always like to take a little vacation for my January birthday. Off to Hawaii for a little R&R. If through all your efforts you're still unable to lose any weight, let me give you some tips. My name is Dr. Michael Chang. I'm the owner of Healed and Whole Clinic here in Sunnyvale. And my background is I'm a board-certified anatomic and clinical pathologist. I worked in San Francisco at St. Luke's Hospital for many years. Then I branched off into my family business in nutritional supplements, looking for a better alternative to conventional medications. Which I see so many people on, but not really getting healthier. They suffer through all the side effects and basically just mask their condition and not getting to the root cause of their condition. So I studied functional medicine at FMU and became a certified practitioner in 2012. And I did a hybrid type of practice incorporating functional medicine, primary care, and medical cannabis. And about a year ago, I developed my own health issues. I had back issues, severe degeneration, degenerative disc disease, and causing me pain when walking, and basically a form of neuropathy. And so conventional medicine really doesn't offer any kind of permanent solution for that other than just NSAIDs. So I really felt the need to find an alternative, and so I did some functional testing on myself and found out that I'm gluten sensitive. I have non-celiac gluten sensitivity, and this affects a large percentage of the population. They say perhaps up to 30%, but the great majority, just like myself, don't realize they have this condition. The pain is not obvious. It's not necessarily timed with when you eat wheat. It may be just very mild, vague bloating. It could be hours, if not several days after the event. So this is a major health concern that affects a lot of people. It's one of the major causes of inflammation in the body, leading to leaky guts, more inflammation, and eventually autoimmune diseases. So it's really important that you get tested if you have various inflammatory conditions or weight issues. So I became a gluten specialist through Dr. Osborne earlier this year, and I started my clinic this fall of 2017, and I really want to address the growing health concerns in this country, the poor health conditions of people of all ages, starting very young. They're developing old people's disease already, autoimmune diseases, prediabetes, diabetes by the time you're teenagers. And it can all be attributed to the sad the standard American diets. And we are being inundated with poor food quality that's sprayed with pesticides, that's affecting our gut, our exposure to pollution, to heavy metals, of living industrialized world, and of the increasing levels of stress that beset us every day. And so I'm a part of a new revolution in medicine to really address the root cause and get people off of prescription medications and onto good, healthy diets, mainly plant-based diets, and lifestyle changes that will change their genes directly. It's the science of epigenetics, and this can really address truly the root cause of the conditions. So why functional medicine? It's the medicine of the 21st century for chronic conditions. It's characterized by the 4 Ps. It's a personalized medicine, meaning that the treatment is personalized to your genes and your environments, and not a one-size-fits-all type of approach. It is also predictive, meaning that the functional tests that we do are not offered by conventional laboratories. They can predict the development of various chronic conditions early on, so that it may be treated and prevented. So it is a preventive medicine. We want to take action as early as possible, such as the gluten condition for myself. If I ignored it, it would have led to further inflammation, further arthritis, further disability, and just lack of general health. And so now, for the first time in history, you don't have to just put up with your chronic pain and chronic disability and low-level function. We have a totally different approach to your medical condition, and I hope if this style of medicine resonates with you, that you really join me in this revolution of medicine. Basically, functional medicine is holistic. We look at the entire body, mind, spirits, as well as the body. And it is centered on the functional systems and not on organs and diseases. Some of these functional systems will deal with assimilation of food, with digestion, and detoxification, with energy use, with transport system, and with the structural system of the body that transcend single organs. The treatment is always dietary and lifestyle changes, and not medications. And these changes are permanent through epigenetics that we talked about. Why is there a need for functional medicine? Chronic diseases are at all-time epidemic proportions, consuming the majority of healthcare cost, and pretty soon this country will simply run out of money treating the increasingly expensive medications used for autoimmune diseases, for example. And yet the results are quite unsatisfactory in conventional medicine. We spend more money on our healthcare than the 10 richest countries combined, and yet we rank in the 30s, along with second world countries, in terms of